Conrad James Fisher first came to us on May 6, 2013, as a 39-year-old male experiencing large mood swings, depression, and irritability. At first, we thought he just needed a new dose of fluoxetine, or a new prescription, because he was previously diagnosed with depression in 2001. I consulted with Dr. Alex Ray on the case, and we agreed. We set him on his way with a new dose, a higher dose of fluoxetine, and he was gone. The dose was administered by pharmacist Dr. Arizona Robbins. When Conrad returned 7 months later, experiencing a new set of symptoms, we knew we had missed something. He had weakness in his left arm, muscle spasms, he was clumsy, stumbling, he had difficulty concentrating. A new consulting doctor, Steve Moscow, and I prescribed him with Flexeril for muscle spasms and conducted a drug and alcohol screening. When everything came back negative, we ordered a genetic test and requested he return in a month with test results and another checkup. He returned on January 14, 2014 for the results. We learned that he had tested positive for a gene and had to tell him the hardest news he could hear. He had Huntington's disease. We then explained everything to him, and after a long conversation, we concluded that he would return at every new symptom. We had him revise his will, and we promised the best quality of life we could offer him. That day, we got an MRI of his brain, an EKG, and conducted a neurological exam, also known as a mini mental state exam, or an MSE. Huntington's disease affects mostly your nervous system, but also the rest of the body as well. It causes your brain to deteriorate along with the functions of your body. It provides each system with its own problem. For example, the digestive system may not be able to have complete control of its bowels, might not be able to break down food properly, causing regurgitation, or have excessive diarrhea. When the brain starts to break down, it breaks down parts that controls other parts of the system. So, as this goes away, the functions for this goes away. Another example would be the endocrine system. The endocrine system may produce too much or not enough of a specific hormone, and it'll change the way the body processes things like stress or sadness. This would cause simple things like irritability, depression, or significant mood changes, all symptoms that Conrad had in the beginning. Or the cardiothoracic system. It may cause uneven pumping of blood, or even heart failure, which is the second most leading cause of death in Huntington's disease patients, and sadly the death for Mr. Fisher. Now, let's pause for a moment about Conrad to talk about what is Huntington's disease. Huntington's disease is primarily a neurological genetic disorder that is caused by an extra production of Huntington protein due to an abnormal DNA sequence. Look at this model of a DNA strand. This is what a typical HTT DNA strand looks like. But if you look at this model of a DNA strand, this is what a Huntington's disease DNA strand looks like. As you can see, the difference being that this one has 3 CAG strands, and this one only has 2. This is how you would tell if somebody has the Huntington's gene. If on chromosome 4, in this specific gene, there's 1 or more extra sequences. Typically, a patient will live about 15 years after beginning onset symptoms. Not to spoil the ending, but if we go to Conrad's case, we will see that he lived 12 years after originally experiencing symptoms before dying on May 19, 2025. I will now go over hospital visits.
May 6, 2023. Admitted for depression. The first time he was admitted to the hospital for Huntington's-related symptoms. Symptoms include mood swings, depression, and irritability. December 9, 2013. Admitted for muscle spasms. Symptoms include difficulty concentrating, stumbling, clumsiness, spasms, and weakness in the left arm. Tests include drug and alcohol screening and genetic testing. Treatment recommendations include Flexeril, a muscle relaxer for 20 milligrams daily, and return in 1 month for genetic test results. January 14, 2014. Admitted for results. Symptoms include the same things. Tests include an MRI and an MMSE. Treatment recommendation is the same. Return when experiencing new symptoms. August 5th, 2014. Treated for insomnia. Symptoms include insomnia or triple sleeping. No tests were ran. Treatment recommendations are the same, including sleep. We are not prescribing medication. February 14th, 2015. Admitted for full numbness of left arm. Symptoms include numbness. Tests were not ran. Treatment recommendations stayed the same. December 12th, 2015. Admitted for a checkup. All previous symptoms were displayed. No tests were ran. Treatment recommendations stayed the same. Around the year 2016, we noticed a pattern with Mr. Fisher's healthcare. We decided that it'd be best if Conrad was able to live his best life without frequent visits, so we asked him to begin coming in only once or twice a year for checkups to review the symptoms he was displaying. June 30th, 2016. Admitted for a checkup. Symptoms are all previous, but severity has increased. Tests were not ran. Treatment recommendations stay the same. March 19th, 2017. Admitted for checkup. Symptoms are all previous. Tests were not ran. Treatment recommendation is the same. September 15th, 2017. Admitted for a checkup. Symptoms include all previous. Tests were not ran. Treatment recommendation stayed the same. July 13th, 2018. Admitted for a checkup and bad insomnia. Symptoms include all previous plus bad insomnia. Severity has increased. Tests were not ran. Treatment recommendation stayed the same. January 31st, 2019. Admitted for slurred speech. Symptoms include all previous plus the slurred speech. Tests were not ran. Treatment recommendations stayed the same. Around COVID times, we were unable to make as many in-person appointments as previous. Though we tried, difficulties arose, and we only saw Mr. Fisher once a year from here until 2024. April 23rd, 2020. Admitted for a checkup. Symptoms are all previous. Tests were not ran. Treatment recommendations stayed the same. June 2nd, 2021. Admitted for a checkup and significant weight loss. Symptoms all previous, but severity increased, and weight loss. Tests were not ran. Treatment recommendations stayed the same. April 8th, 2022. Admitted for a checkup. Symptoms all previous. Tests were not ran. Treatment recommendations stayed the same. May 20th, 2023. Admitted for a checkup and difficulty walking. Symptoms include all previous, but the severity has increased. Tests were not ran. Treatment recommendations stayed the same. March 6, 2024. Admitted for a checkup. Symptoms include all previous. Tests were not ran. Treatment recommendations stayed the same. September 11th, 2024. Admitted for heart dysrhythmias. Symptoms include chest pain, heart palpitation, and problems. Tests ran were an EKG diagnostic. Treatment recommendations include rest, same as previous. On April 18, 2025, we gave Conrad Fisher about a month to live. He signed an AMA saying he no longer wanted to be on medication and said that he didn't want to be kept alive by machines. We didn't see him until 1 month and 1 day later on May 19, 2025, when he was admitted to the hospital with no pulse. We gave him CPR, but he unfortunately passed away that day. Conrad Fisher experienced what it was like to live with Huntington's disease. We let him go, and he died surrounded by his wife and 2 daughters. He experienced a heart attack from the effects of Huntington's disease.